For those of you who don't know me, my name is Sergio Matos, and I am the Executive Director of the Community Health Worker Network of New York City, and the director of this statewide CHW initiative that we are here today to celebrate. We are here today to launch a report written by the CHW initiative, the statewide initiative. The report is titled Paving a Path to Advance the Community Health Worker Workforce in New York State. We are also here today to announce the formation of a statewide New York State Community Health Worker Association, which the Community Health Worker Network of New York City has partnered with the Community Health Worker Association of Rochester, who is represented here today also. So to introduce this press conference, we have the Honorable Assemblyman Richard Gottfried.
Thank you. Well, this has really been an extraordinary effort and really exciting to be part of. I think everyone is beginning to understand that both improving the quality and accessibility of healthcare and helping to control its costs and improving outcomes are all interconnected. And to make all of those things happen, we need a lot more integration of healthcare. The various parts of the healthcare system need to be talking to one another. People need coordination and management of their care. People need help in accessing the care that they need that they may well not know about. People need help in staying on their meds or their diet or their exercise recommendations. There's an endless host of ways in which people and healthcare providers need help. And community health workers have shown themselves to be an extraordinarily valuable and effective part of that system. And the goal here is to develop that profession, bring more people into it, and integrate it more thoroughly into the healthcare system. And the recommendations that you'll be hearing about today talk about providing financing for community health worker services, because while community health workers are wonderful people, they can't spend their whole life as a volunteer. They need to make a living, and they need training. We weren't born knowing how to connect people to the healthcare system and help them guide their way through it. For the benefit of the community health workers and the public, they need a certification mechanism so that the people that are going to employ community health workers know that the people they're employing are qualified to do the work, and the nature of what they are supposed to do with that training and certification also needs to be defined, so that when people say we want to bring on board another community health worker, people know what that means. That's what these recommendations are aimed at, and I think if New York can take these recommendations to heart and move forward with them, we will be doing an enormous amount of good to help improve the accessibility and the quality and bring down the cost and improve the outcomes of healthcare in New York.
Thank you, Mr. Assemblyman. That was very concisely and eloquently stated. The challenges of health reform today are actually pretty enormous. The legislation that was passed to reform health in this country and healthcare financing in this country demands that we improve access, improve quality, and at the same time lower costs. I know that we throw those three challenges around a lot, but if you reflect for a moment, you might realize that that's never been done in this country. So the challenges of lowering costs while increasing access and improving quality are really pretty enormous. And community health workers certainly have a role to play in that. Thank you, Mr. Assemblyman. We also have with us today Dr. Andres Nieto, who works at New York Presbyterian Hospital and runs a very large community health worker program there, and he has some comments.
First, I just want to clear up, I'm not a doctor, so I just want to make sure you. I've been actually working with community health workers for about 15 years. I've been with New York Presbyterian for 30. And I remember about 20 years ago, we started working with interpreters and the role of interpreters in healthcare. And that was something that at the time, 20 years ago, people were saying, how are we ever going to get this done? And now, in most healthcare institutions, we have medical interpreters that go and when a patient comes to the hospital. And 20 years ago, I thought that would never happen, but it has. And the role of community health workers, I feel, is as important as the having medical interpreters for patients. And we've had successful programs where we've worked with community health workers first to work with emergency use. We call them frequent flyers, or patients that go to the emergency room regularly for primary care. And using community health workers, we were able to drive down and get those patients to the right services, to primary care, and we were very successful in that. The challenges with community health worker, working with community health workers has been in the past that you had to get a grant in order to hire community health workers, because it was difficult to convince people to hire community health workers if they're actually driving down your ED utilization and your inpatient admissions, right? At one time, that was difficult for people to understand. Now with healthcare reforms, we know that it makes sense to do that. So we've had a program called Win for Health, Win for Asthma originally, where we originally received funding from a foundation to pay for it. And we were able to show through the use of community health workers that we were able to drive down ED utilization by 50% and inpatient admissions by 50% by using community health workers. And so we were able then to convince the hospital to agree to fund community health workers, and presently the Win for Health program is paid for by hospital operational dollars. So we have a permanent program that will not go away, and we're very excited about that. We are now a level 3 medical home, NCQA level medical home. We're working with community health workers. They're an integral part of the medical home that we have in our ambulatory division, working to provide much needed resources. And community health workers are interesting because patients will come to their doctor, and the doctor will ask them questions in regards to their living situations, and most of the time patients will tell them what the doctor wants to hear. Using community health workers, we're able to actually go into the home, have a different relationship with the patient, and understand some of the other needs that the patient has. Recently we had a graduation for our Win to Health program, or our Win for Asthma program, and one of the mothers that received the services of a community health worker stated that the community health worker helped her get a job in the community, helped her get citizenship in this country, access to care for her young children. And her children, she feels now that her children's asthma is under control. And she used to come to the emergency room, she said, about twice a month with her child's asthma. And now in a year, the child has not come back to the emergency room with asthma. So community health worker program, in my opinion, it works. It's a great program, and I think that it's going to help us drive costs in healthcare. Thank you.
Thank you, Andy. And also with us today, and it's my pleasure to introduce to you Glenda Blanco. Glenda Blanco is the chair of the Community Health Worker Association of Rochester, and has partnered with us here in the city to establish a statewide presence and a statewide CHW voice to inform policy and practice issues relevant to our workforce. So, Glenda?
Good morning, everyone. Well, my name is Glenda Blanco, and I am currently the chair for the Community Health Workers Association of Rochester. I've been a community health worker since about 1993. I kind of fell into the position by accident, and someone down the road just said, you know, she has the ability to maybe go out, and she knows the community, was born and raised in that community. She can relate better and bring in these clients that we need for a certain study that was piloting at the time. And now 18-something years later, I'm still doing the job and love it. A lot of community health workers pretty much are kind of the same thing. They know the area they work in, and they just build this relationship. A lot has changed since then, and you know, Schwar is really excited to be a part of the initiative and the changes that are going to be coming forth. We have currently about 185 members in Rochester, and we really try hard to advocate and strengthen the work that they do and kind of educate the public on the importance of community health workers. I know a lot of community health workers are also funded under grants. So every year we're on pins and needles, you know, are we going to be refunded? So having a steady flow or a workforce developed for CHWs that will maintain their income on a permanent level and so forth, that's a big deal for a lot of CHWs. We currently have had the credentialing training done in Rochester, which was wonderful, you know, and quite a few CHWs did participate. We collaborate a lot with the public health agencies and promote. You know, we're trying really hard in Rochester to have CHWs recognized for the hard work they do and incorporate them in the workforce, wherever that may be, if it's in a hospital setting, a nursing home, wherever. A lot of the questions that come up are, what are CHWs, you know? So I think that's the biggest tackle that we have, the obstacle we have in Rochester is still trying to get employers and other agencies to see what CHWs are, what they do, and what they bring to the table, and to become more of a group workforce would be, you know, beneficial. And you know, we have the other board members here also. Some of them are kind of wandering in the city still, so they should be here shortly. But I want to thank everyone and thank the initiative for having us here today.
Thank you, Glenda. And thank all the folks that came down from Rochester. So for those of you who don't have experience with community health workers, if you would bear with me, I'd like to read you a story. And the story is written in the first person. So I'm not speaking about myself, but I'm speaking for the author. I became a community health worker by accident. You're not the only one, Glenda. I became a community health worker by accident. My nephew, who lived with us since he was born, was diagnosed with asthma at the age of 2. Dad wanted to follow the medicines the doctor gave us, but Mom believed in home remedies. It was hard for me to grasp what was happening. I needed to learn about the disease so I could ask the doctor questions. As I learned how to help my nephew control his asthma, I became an ad hoc community health worker. That was more than 19 years ago when I lived in Peru. When I came to the United States, I had to spend a lot of time discovering how to do new things, how to maneuver the systems here, because no one had answers for me. The healthcare system was so large. How did people know what questions to ask? Where did they go to find answers? Why were they afraid to confront their doctors? It was these kind of journeys that led me to finally become a professional community health worker 6 years ago. My first patient was a middle-aged man from Bangladesh who spoke limited English. After first talking outside his front door for 10 minutes, he invited me into his apartment, where we conversed for another half hour, his wife and 3 children on the floor with us, as I explained who I was. Finally, he showed me the boxes. 2 large moving boxes stuffed with thousands of sealed, never been opened envelopes. He asked me to read them. The letters were from doctors and bill collectors and credit card companies. He told me to start with the medical ones, and so I did. As I opened letter after letter, we quickly learned that one of his children had lead poisoning. What I did next was obvious to me, but intimidating to them. I found the family a doctor. I went with them to their appointments. I translated for the doctor and the patient. I was the only bridge they had to ensuring proper and accurate medical care. I now work closely with the New York State Community Health Worker Initiative, which is launching a statewide network of CHWs and making bold recommendations on core competencies, training standards, and financing streams that will allow CHWs to fan out across the state in large numbers as frontline trusted commissars and to help those most profoundly in need. If we are able to be successful in getting better outcomes overall, lowering costs throughout the system, and helping more people live longer, healthier lives, then we must integrate what happens inside institutions with what happens outside institutions in our communities, because health happens in the community. I'm a community health worker, and this is what I do every day. Most of you know the author of this story. So if we are really going to make a difference in the system and in the lives of people that live in our state, then we need to understand this fact that health happens in the community where people live and socialize, not only inside clinics and hospitals. Disease management often happens in the hospital, in the medical office. Health happens in the community. You can't be healthy if you don't have the things that you need to be a member of your community and have a society around you. For the past 64 years, I was just a sparkle in my mother's eye. But for the past 64 years, the World Health Organization has defined health as a state of complete spiritual, physical, and social well-being, and not merely the absence of disease. Not only is that definition true, but 64 years ago, the World Health Organization also declared that this state of being, a state of complete spiritual, physical, and social well-being, was a fundamental human right 64 years ago. And yet this country continues to minimize prevention and focus on the treatment of disease. Furthermore, we give short shrift to the importance of the spiritual and social aspects of being well. Well, this is about to change. With the implementation of health reform, providers will no longer be paid for incidents of care. Health financing is shifting to paying for outcomes and financial incentives that reward networks of providers and community-based organizations that can care for the whole person and not just the disease. Andy's example was a perfect example of that, where his institution has formed networks so that they could provide take a holistic approach to people's health and the people that institution serves. As our population ages and experiences more chronic diseases and multiple chronic diseases, the role of CHWs will be crucial in combating the social isolation and depression wrought by a medical system that isolates individuals in their diseases. Working with people in the community is what community health workers know best. They have shared life experiences with the people that they serve and can therefore help people understand their condition and prioritize these issues in their very complicated lives. As trusted members of the community, they forge bridges between the community and the health and social service system providers. They coach people on specific steps that they need to learn how to navigate complicated treatment strategies and protocols. They help families get connected to the services they need so that they can concentrate on their health. They provide support for families who need to learn how to do things differently in order to stay healthy. And just as importantly, CHWs also help providers become more appropriate to the people that they are to serve. The result is better health, better community, and a better state. We estimate that there are currently about 5,000 CHWs working or recently trained and ready to go to work right here in New York. The tremendous benefits that CHWs provide have already been proven. Studies show that CHWs improve health outcomes, particularly for low-income populations, when they are utilized in disease prevention and chronic disease management models, like the control of asthma, diabetes, cardiovascular disease, depression, and multiple chronic diseases. CHWs help more families stay out of the hospital and emergency room, as Andy Nieto spoke about today. And this dramatically reduces costs. Healthcare costs like emergency room visits and hospitalizations go down when CHWs are involved. And patients and communities better understand their responsibilities and healthcare options. Our new report, Paving the Road to Advancing the Community Health Worker Workforce, shows us exactly how to better integrate CHWs throughout the state and make New York a cutting-edge leader in healthcare and social services delivery and reform. The recommendations are a package deal, which together would consolidate and strengthen New York CHW workforce. Among the many important recommendations in this report, it finds that financial incentives should be provided by New York State for programs that integrate CHWs, and that payment guidelines should be established for all CHW services. In particular, it calls on the state to follow the lead of the Patient Protection and Affordable Care Act and name CHWs as health professionals and as members of the healthcare workforce, therefore supporting the integration of CHW in emerging health reform innovations such as health homes, patient-centered medical homes, and accountable care organizations. We welcome you today to our first statewide conference of CHWs, and we look forward to the rest of the conference. Thank you.